Dr. Uma?
Ma'am, I think, ma'am, we are now here. Everybody can listen us.
Yeah, I just wanted to talk to Dr. Uma. Has
Ma'am,
she
she,
joined or not?
ma'am, she muted herself.
I'll give her a call. Wait.
Yes, ma'am.
So, good evening, everybody. We have Dr. Uma Gupta. She's also a FAMER Fellow. And I request Dr. Uma to please introduce herself. Today's session is supposed to be taken by Dr. Salman from the Department of Community Medicine and Dr. Uma together. But because of some personal reasons, Dr. Salman has not been able to join. And Dr. Uma was very kind enough to volunteer to do it all alone. So, Dr. Uma, can we
Yes,
please start? And I would request you to introduce yourself.
myself, I'm Dr. Uma Gupta, Professor and Head, Department of Obs and Gynae at Mayo Institute of Medical Sciences, Barabanki, attached to Lucknow. I did my FAMER from CMCL and I did my MHP from KGMU in 2019. And I'm really thankful to the whole of the team to give me an opportunity to tell about integration and Obs and Gynae teaching learning methods. Good evening, all of you. Can we start?
Yes.
We all know that the teach has to get converted into learn. Whatever informations we are giving, the information should be converted to knowledge is the aim or and the object of the whole of the learning process. The objective of this session, next slide please. Next, the objective of the session are at the end of this session, the participants should be able to discuss some common methods of integration and apply these methods in their own teaching context. Next slide, please. We all are having this document, Module 4 on alignment and integration, and with which we have already been introduced by Dr. Nachiket, and Madam has been kind enough to circulate all this. So we are aware of the various terminologies and how this should take place. Next slide, please. The regulation recommends that only small portions not exceeding 20% has to be integrated. So this, keeping this in mind, we start. Next slide, please. Next slide. The regulations have already also given examples of the various topics which should be integrated, and this is the list from the book itself. Next slide, please. Just to refresh, alignment implies to teaching of the subject material. So this is from the same phase and in the same time frame. And this is the temporal coordination which we all are aware of. Next slide. Next slide. And what is integration? Integration implies that the concepts in the topic or the organ system which are similar or overlapping have to be reduced and merged into a single teaching sessions, which this timetable on the figure on the right very nicely states. The individual blocks are alignment and the blocks together are merging of the subject and integration. Next slide please. What is done, like 1 hour if one subject is taken and in the another hour our other subject, this is not integration, this is alignment. But when both are taken together and the borders are merged, then it will be integration. Next slide please. Next. Next slide please. When integration takes place among the subjects being taught in the same phase, it is horizontal. This could be both preclinical, paraclinical, or clinical, or when the integration takes place among the subjects taught across different phases, then it is vertical. Like radio diagnosis with obs and gynae and anatomy with gynae, this is all vertical integration. And surgery, medicine, gynae together like will be horizontal integration. Next slide, please. Advantage, this reduces redundancy. There is a contextual learning. Correlation between the basic and the clinical sciences is better, and it also promotes faculty communication is also good. Next slide, please. Next, yes. Now, the various types of the teaching learning methods. There are the lectures, tutorials, seminars, symposiums, workshops, self-study, demonstration. This is all mostly which is related to the cognitive domain if we look upon. And then for the practicals, we have got clinics, simulations, role plays, video clips. These are all what are related to the practicals. Next slide, please. The classification of the TLM can be just click, ma'am. It could be based on the domain, on the group size, and the control, whether it is by the teacher or the student. The classification is based. Next slide, please. Lecture, panel, symposium, then of the self-directed, whether it is a project work or assignment, is all related to the cognitive domain. And to the psychomotor domain, the simulations, bedside clinics, demonstrations, some practical workshops on hand, they are all psychomotor based. An affective domain to be covered by role play, demonstrations, movies, even bedside clinics, and some workshops of the communications which people take. These will be domain based, that we may be covering various domains also while integrating. Next slide, please. Now, based on the control, the teacher control models are lecture, symposium, demonstration, a bedside clinic, and the learner controlled are where it is a free group discussion, project work, problem based learning, and self study, that is self directed learning. They are all learner controlled. Next, next slide, please. On based on the group size, if it is a large group, we take upon like methods of lecture, panel discussion, symposium, or a team teaching. When it is a small group, we can take these methods, the group discussions, seminars, bedside, field visit, tutorials. And when we want them individually to study the subject, then counseling, self-study, project work, assignment can the models which can be selected. So now we have got various things depending upon the size, depending upon the control, depending on the domain. So we will select proper method according to all this. Next. So then again based on the modules, it could be topic based module, problem based module, or task based. So uh, depending on what is a topic, what is a problem, and what is a task, we can use different group of methods. Next slide, please. Next slide, please. The didactic lectures, as we all know, this is one of the oldest, and even now it is still more common. It's still common. The approach is consisting of that there is a large group which is being delivered lecture by the faculty in a traditional way, and this is more important when we want to sensitize the class with a basic concept. And as this picture shows, like the teacher should not simply take, it should be a interactive. You should open their minds. The student should be made interactive and alert in the class. Simply walking while when they are sleeping, that could not be a good way. So the lectures are supposed to be interactive so that the student is oriented to the class. Next slide, please. Next slide. Lecture come demonstrations. Symbiotically, both of them stand together. In the didactic lecture, information is being given, but if the same information after being given is followed by demonstrating them or making the things available practically, this becomes a practical session or a demonstration. Here, the student is better involved with the subject. Though lecture is purely instructor centered, the teacher centered method, now there are methods which are being adapted so that only from being teacher centered, it would be interactive, and even the students are being involved by making the lectures interactive. So by these lectures, the purpose of the students to get to develop skills, gain some knowledge, and also help in learning to solve the problems are also now attained. Next slide, please. Next slide, please. As we can see that we should have all our learners who are active rather than being passive learners. So stimulate the student, let them be active for the class, and then instill the lecture or the knowledge so that whatever knowledge is given is taken by the students. Next slide, please. The advantages of the interactive learning, therefore, will be that it will incite the thinking, it will promote higher level of understanding. The student can apply the learning to different situations. The student is facilitated by the students, and they are also useful in decision making in future. So it's not all about superficial learning. The interactive lectures will help them to retain the knowledge and the facts, and this will be applied better in future. Next slide, please. As we all know that attention span is say for the 20 minutes. So at the end of every 20 minutes, some student activity should be continued with the interactive lecture so that the student remains within the class instead of wandering outside, and his attention is again built upon. Next slide, please. Next slide, please. Yes. Now this is a changing phase of the class. We have our classes still as it is on the left, either sitting side by side or in a line. But now the future classrooms will be like this, where there'll be small group teaching, small group sessions, and the teaching will be a large group session be conducted, and every now and then small group discussions or small group teaching will be also carried simultaneously. Next slide, please. Next, yes, again, next slide. So this is a phase of a future class. The large group teaching, especially lecture, is important to if it is planned properly and including a number of interactions to ensure effective learning. Next slide. Next. Then another method is a case stimulated interactive lectures or case based learning. Now, this is currently most of the times this is a trend which is being followed. So, the approach is that a patient problem is accompanied by a number of questions, and such interactive stimulatory method ensures highlighting of the basic science concepts, which is most of the times covered like nesting of the concepts by the teacher, and then based on this, the students' responses are taken. Some lectures include presentation of a case scenario followed by group discussion amongst the students, and finally the faculty will be summing up, stating them the learning objectives and making them learn like what was the objective of the class and what they have learned today by this case stimulated learning. So here by this, a reasoning ability sets in within the large group. Next slide, please. Uh, Next, yes. So case-based scenarios are given, then even the investigations are given to the students so that they are able to interpret the investigations which they receive from the patients. Whatever investigations are ordered, they should learn how to interpret. So in a case-based learning, the patient actually visits a case, able to uh, do a thinking, analyze the case, and also able to interpret the investigations. Next slide, please. So advantages of the cases are the case-based learning gives insight into the phenomena that cannot be learned in another way. A true case is a case, and seeing the cases gives them a real perceptions. Then this simplifies complex situation. It improves in them an analytical thinking and also helps them how a problem is solved. Now, the disadvantages is that this could be time consuming. Sometimes there may be errors in their judgment, and it is also difficult to get appropriate case all the times with the situations and with the timetable. And sometimes, at times, if the patient is sick, it could be also unethical to take the case or make the case being visited by so many students. Next slide, please. Next slide, please. So
Actually,
there are limitations
Dr.
of the feasibility. Yes,
Okay,
yes, ma'am.
point interrupting you. There's some time lag between the, I changed the slide, but it reaches you late. I don't know, some because of the net problem. That is why you have to repeat again and again. Sorry.
It doesn't matter. Now, the limitation issues are that the competencies may not be linked. There could be feasibility issues of the cases, and uniform standardization may not be maintained. That is competency to be integrated with the case all the times with all the students. Next slide, please. Next slide, please. There could be group seminars or panel discussions. This could be for like a moderate size group or the large group, both it's possible. The topics of clinical relevance should be assigned to a batch of students who prepare seminar under the supervision of faculty and present the topic to a large class. Now this we are also practicing, and this we call it as student-led seminar. The topic is divided among the students, and in 1 hour duration, each of the student presents and interacts with the large group. This is followed by summing up by the faculty from the relevant clinical discipline. These seminars are intended to induce participation by the students. So the student participates, student is interested, they learn to communicate, and their presenting skills are also improved. Next slide, please. Next, 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 ma'am. The example will like there are 5 slides continuously. Now here, this is an integrated timetable on tuberculosis, and there is a 5 days schedule. Here you can see that different subjects, micro medicine, general medicine, chest medicine, micro pharma, pathology, all the subjects are together involved for the tuberculosis, and it is a 5 days program integrated. Here, this is a day every day 2 to 4. They were conducting the integrated teaching involving all the subjects, involving all the domains, and involving theory, practical, and adcom, everything together. So we can just go to next slide, please. Day one was the theory part. Day two, you can see it is the laboratory science and clinical presentations. Then managing the case, visiting a dot center, telling about multi-drug resistant tuberculosis. So it was one of the very good examples, which is a published literature. Next slide, please. Next, yeah. 16 number as on the day 5, group seminar by the students divided in batches of 5. They made all 50 students present turn by turn. So it was like group participation by the students almost every day. And they were also role playing, and their role playing was in context to how the dots was managed. So this example is like one of the good examples where all the fields, all the domains multiple subjects, a vertical integration was brought about very nicely. Next. Now for the sharing purpose, suppose if the subject A has got their specific learning objectives 1 to 5 and another subject of 1 to 4, there will be issues. Next slide, ma'am. We can see that the SLO A1 and of the subject B, SLO3 were both same. So how they have done a redundancy and they have done integration. Next slide, please. The redundancy has been removed and SLO1 has been replaced only by SLO3. So this is a way that we can make our SLOs of our subject with another subject, and then when we are integrating, we can reduce the number of the objectives and do a sharing. Now this is another example. Next slide, please. Uh, it is on sharing and nesting. Next slide, ma'am. Uh, please go to the next slide. Here there are objectives and they have been colored into yellow and orange, as you can see. When we are having different objectives, there are few which can be nested and there will be few objectives which can be shared.
Please hold on. Just there's some problem.
Yes, yes.
I'm enabled. Neha, what happened to this? Neha, are you there?
Yes, ma'am, I am there.
I don't
Ma'am,
know. Slide disappeared.
something
I don't
in
know.
your own laptop, ma'am, I think.
I'm clicking on go to
Ma'am,
meeting. Oh,
ma'am,
sorry.
are you
Yeah.
not able to open it?
No, I don't know
Wait,
what
ma'am.
happened to the slide. I'm on go to webinar, but the slide just disappeared. I don't know why.
Just a sec, ma'am. Just a sec.
Yeah, it came back. It came back.
Ma'am, just wait, ma'am. Ma'am, you again please share the screen.
Okay. Show my screen.
Yes. It's opened, ma'am.
Hold on. Yeah, I don't know what
That
happened.
must be something like 40, must be 40.
Sorry for that, Dr. Ma.
Doesn't matter. Ma'am, it is something around, it must be around 38. Yeah. Again. Yes, this one. So there are times when the learning objectives by the different subjects are made, and then there are few which can be shared and few can be nested. As you can see very well here, the yellow ones are the objectives which are being nested, and the light orange are which were shared. So SLO3 here is being shared. So we could take different examples by which we can do sharing and nesting in the topics which we select. Next slide, please. Like here, these are examples of nesting of two objectives. Next slide. And here, as you can see that this SLO3 is being repeated again. These are examples of reinforcement. At times, there are certain issues which are very important, and it's not that they have only to be integrated, but they need reinforcement. Now, you may be remembering, like if you've seen that picture Drishyam, how much of effect reinforcement has in remembering and reproducing. So we have to use those good facts, like it's not only redundancy every time, at times even reinforcement is essential. Next slide, please. Now, Next, ma'am. So the patient exposure or early clinical exposure. Now, in the current scenario, we have already started with early clinical exposure, and this is one of the examples of vertical integration to the first years or to the newcomers who have come. The students here are accompanied by faculty, and they will be visiting hospitals, and maybe they may see only some prototype of disorder. It's not for the purpose of learning a clinical scene all the time, but here they will have a view of how the patients are, how the histories are taken, how the symptoms are observed. It is like learning to observe and learning to behave, and just having a view of how the hospital is and what is the doctor patient relationship, how does that interaction and communication take place. So these are all the basic etiquettes which we want our students to be addressed upon by the ATCOM module, that is the Attitude, Ethics, and Communication model, is partly passed on while the patient exposure and the early clinical exposure is being done. And here at times, if you're having interesting cases like a case of severe hypothyroidism or a clinical neurological deficit, now a severe anemia, now those types of the patient can also be shown upon clinically so that the student gets interested better for the learning purpose. Next slide, please. Next slide. Then teaching learning method by role play. Now, role play, Dr. Tamkeen had already wonderfully expressed, but this is again to reinforce that teaching learning method of role play is one of the methods which is very commonly now being used, and it is noticed that in a protected environment, in a non-threatening environment, the student learns how to apply the communication skills better with their patients. So here there are the features of understanding, self-disclosure, respecting, telling truth, being honest, and also how the reflective thoughts are expressed. They learn that how it mean what it means to be appropriately listening. The listening skills work wonderfully when you are listening to your patients in the OPD, and understanding their concepts is of much more value, and it adds to your therapeutic communication. So the way you hear and then what you say means more than simply prescribing and writing. So by asking the students their experience and by making them role play of their previous uh, understanding and their experience, it helps the students to learn better. Next slide, please. The idea of the role play is in simplest is, imagine the student have to imagine themselves as another person in a given situation, and then act for both the good and the bad roles, and understand how the positive roles have got a positive effect, and listening, eye contact, using a tender touch, giving adjusting the tone, and altering the speech, the speed of the speech, everything makes a lots of difference. It's not just words, it is uh, the way in which the words are expressed, which means, and this all they learn and they demonstrate by the way of role play. Next slide, please. So that was how like we can conduct role plays for our given situations. Next slide, please. This is also like how we learn to give effective feedback. Now, everyone uh, learn about feedback, but maybe in a wrong way first and in a good way later. So, giving effective feedback could be a very good way of learning. Next slide, please. Then, when it is like self-directed learning or self-learning or individual learning, the creative project, the project-based learnings are very important strategy. The teacher here sets a goal for the learner and then allows the learner to explore and create the project. Now, one of the ways which we are already doing is the ICMR projects, the STS projects by the student is one of the very good ways of the creative projects. So here, this is all learning by doing. And here the instructor is a pure facilitator. These research projects at undergraduate level are viewed as a learning experience which will only help them to do their future projects and learn in a supportive environment. Now, this instills the research skills in the students, and it is seen that those who are doing these types of projects are having better scores than those who are simply traditionally learning. So, we should motivate our students for creative project writings also. Next slide, please. Next slide. So these are the ICMR projects. You all might have been guides for your students. Next slide, please. So this is all investigative learning, involving the student in learning very deeply, making a good amount of scientific inquiry, also practical learning in certain cases. There is those who are going and collecting the data. It is enhancing their social skills. It is also a psychological boost and freedom to work for the project, encouraging skills of research in the students. Now, some disadvantage only to name could be that it is time consuming for executing. At times, it could be a financial constraint for the student. Then, keeping track of his cognitive learning may be difficult because we are not every time asking the student what he is learning. The project, the data is collected, the project is analyzed, and it is done. Thank you. Next slide, please. Then comes a small group discussions. Problem-based learning depends mostly on small group teaching. Here we will be having a group leader, a moderator, an instructor, a facilitator, and these they all do their part of work so that they keep time and they keep on the track and they follow the principle of doing or solving whatever object is given. The constant there is participant interaction face to face, and this differs from the seminar, which is mostly teacher centered and aims at the specific topic here. Research has demonstrated that group discussion promotes greater synthesis and retention of material. Now, examples of the group discussions could be like the peer assisted learning, near peer learning, collaborative learning, cooperative learning, whatever name you give. But when the students are with their own peers or with their near peers, they are able to solve their difficulties or they are able to ask any of their most silly uh, difficulties which they feel. Could be it is actually a difficult thing, but whenever they are feeling like not asking their teachers, they are able to ask their near peers. So the small group discussions help them in learning better and retaining better. Next slide, please. So the members here acquire knowledge on the subject. They get opportunities to express their personalized ideas, and when their near peers give them instant feedback, which may be good or bad, they normally don't mind. But and the disadvantages are at times these may be dominated by the fellow or the leader. Some students are more dominant and they may dominate and they may not allow the other student to grow. Sometimes the group may grow irrelevant and may go out of track of the subject, and this may again be at times time consuming and may be more expensive in terms of time and uh, in the timetable, the time which is lost may be a little more. Next slide, please. Next slide. Then we have tutorials. These are also another form of the small group teaching, and it gains lots of attention. because here there is lots of productivity, elaboration of the knowledge, and clarifying the doubts and reinforcing upon whatever doubts were left behind. So tutorial is one such method which is very important. It allows the students to develop interpersonal skills. They learn how to present, they learn how to communicate, they also learn lifelong learning skills. These are certain generic skills which the students must develop, and more attention needs to be paid to individual students. Most of the times in the tutorials, the teachers are able to pay more attention to individual students who are not grasping in comparison to their peers. In teaching students to interact professionally as a part of a diverse and a dynamic group, here the group becomes effective when the participants adopt to various roles and responsibilities. Now, some students may be quiet and may not be interacting, so it is for the facilitator to see that each of the students by turn presence. Now, like one of the methods what we adopt is that it's called its name is TOSVA, that is a teaching of bedside teaching, and we take student team based objective structured bedside assessment as it is called. So here we are dividing the students into groups, and a group of five is being given a single case to present. So one student presents the history, another the past history or family history, one will be taking examination, one will be telling about the differential diagnosis, another about the treatment. So the same subject, when five students are presenting in a group, each and everyone is participating and presenting. And we make that each of the student has to go through different roles, and all the students have to rotate through all the roles. So that way, all the students will be given attention, they will be given various roles and responsibilities, and they may learn better to present and communicate. Next slide, please. Simulations. Last time a complete a complete talk was on simulations. So I'll not touch upon simulations. Madam, we'll go to the next method. Next slide. The self-directed learning. Now we all know that the medical curriculum is expanding at a very fast, at a very rapid rate, and it is very difficult that in 5.5 years time the whole of the thing could be taught. We know that we only uncover a part of the syllabus so that the student is able to cover the rest. So with that thing in mind, the heutagogy or self-directed learning is the process in which the learner has to take the initiative to be responsible for their own learning, and that is the art of the self-directed learning. Here the student has to make his own objective of the learning, try to find out the resources, take the help of the facilitator or the teacher to ask for the resources, then make time, create time for their self learning, and do the learning to the best possible, and then see that the learning is done in the time frame in which they have uh, made their goals. So this is self-directed learning, is learning to learn. It is not just a phrase, but it needs lots of work. The student makes his achievement goals, and the goals could be performance goals or mastery goals. So the performance goal is extrinsic motivation, helps competing with the peers to get awards or the punishments, and the mastery goal is the inner goal. So most of the times the pedagogy skills are mostly for the mastery goals, and it is at the studenthood that it is mostly the performance goals. Next slide, please. So this is what we had already gone through, like making the goal, taking the resource, adopting for the activities, monitoring your own performance, and reassessing the strategies. These are the basis of the SDL which the a student has to learn, and this is a part of the self-directed learning. The next slide, please. And how the person will know that the SDL was being done. So there are different questionnaires of how self-management, desire for learning, and self-control. And if these scales are filled and you assess yourself, you will come to know that you were doing your self-directed learning properly. And most of the important resource was SDL is e-learning, and whether it could be a web-based learning or a computer-based instructed learning or an internet-based learning, all the learning are SDL. Now, just now what we are doing is also an example of the self-directed learning, what we are just now practicing. And the disadvantage of the SDL is there may be trials and errors, and there may be points which may lead to failure and frustrations when you're not able to match the information technology system or the network system. This can also be points of failure and frustrations. But then we have to overdo this. Next slide, please. The problem-based learning. Now, in the problem-based learning, uh, the student is not exposed to the subject. He does not know about the system or the topic on which the problem is being given. The problem is given to the class uniformly. They identify the problem, they explore from their pre-existing knowledge, then they generate their own objectives as what they have to learn and what could be the possible mechanisms how to learn. They learn their learning issues, and then there is self-study. They are re-evaluated for the application of their new knowledge, and then finally their assessment. Now here it does not take place in a day or two, it is in terms of weeks. The problem is given and the student is left with the problem for a few weeks, 2 weeks or 4 weeks, and then at the end of them, when they are coming, in between they are meeting their facilitators, they are asking for the investigations or whatever help they need, and uh, they learn the whole of the system or that module by their own efforts. So that in problem based learning, there is no previous class or knowledge on the subject, and the student explores the subject, the objectives to learn, and finally he learns the subject. The next slide, please. And in problem solving learning, the topic is already taught to the student, the subject is familiar to the student, and now about that familiar subject, the problems are given. So now the student will be collecting information about the patient, interpreting the preliminary information, collecting more information, say about the investigation or X-rays or MRIs or whatever, and then they redefine the hypothesis and make their likelihood plausible diagnosis and differential diagnosis. So they find out the formulations of solution to the problem, and then they finally come out with what their plan for treatment is or how they would proceed with the circumstance. So here there is a previous knowledge, and the knowledge is being utilized to solve the problem. So that is a problem solving approach of learning which could be used with the case based learnings. Next slide, please. Then the integrated models. Next slide. One of the most common examples, like tuberculosis being taught by different subjects at different times, and as we think that this cause lots of confusions. So next slide, please. Next slide. Instead of being taught individually by different subjects, the whole thing to be taught by integration, alignment, by nesting. So all the methods of integration to be used so that there is a better understanding of the whole of the subject. Next slide, please. Now, this is one of the examples of the HIV module where different departments, community medicine, dermatology, and general medicine, they all were being involved so that there was uh, it was a vertical integration using 3 days to cover the topic, And the various methods that were used are lecture, role play, panel discussion, group discussion, and finally assessed by quiz. So that is one of the examples of how people use different methodology for a module. Next slide, please. So here there is comprehensive coverage of the subject, multidisciplinary approach for understanding the subject, a better correlation and understanding, varied technology and vertical integration done. There was enhancement of students to participate, and there was also interaction of the teacher and the student at different parts. The only thing is it needs an elaborate planning, consumes time, coordination between different departments is essential. The faculties should be committed for carrying out the modular approach, and it requires good communication skill among the departments. Next slide, please. This is another example from Pondicherry. The literature shows that here this college was following modular teaching. List of modules for all the semesters are given. I've only marked out the obs and gynae part in red. Here in the sixth semester, urinary infection and contraceptions were taken. In the seventh semester, pelvic mass infertility, obstetric uropathy, and this is the eighth semester, PPH, abnormal uterine bleeding, PIH, genital prolapse bleeding. So these, like all these topics were being covered by integrated modules. So that is also one of the examples, like some of them are following so many topics to be covered by integrated teaching. Next slide, please. This is from the curriculum which we have got just now. Now, the vertical integration and nesting can be done for this competency OG 14.1 about the maternal pelvis to be integrated with human anatomy. So, next slide, please. This can be integrated with anatomical this 53.2 and 3, which is to be integrated with the gynae. So, by taking sessions by a lecture and by one demonstration, the pelvis can be covered, uh, integrating both the departments anatomy and obstetrics and gynae. Next slide, please. Another example of horizontal and vertical integration together, like the pathology is having a competency 30.5, in which there is all about gestational trophoblastic neoplasms to be integrated by opsin with opsin gynae by lecture and small discussion. So in one of the demonstration classes and in one lecture, next slide please. So 9.4 of the obscene gynae is also uh, gestational trophoblastic neoplasms. So, and this is to be integrated also horizontally with radio diagnosis about the radiological signs in GTD, using radio diagnosis as a nesting and using a lecture and a small group discussion with pathology, like the vertical and horizontal integration can be done for gestational trophoblastic disease. Next slide, please. So integration is organizing contents based on their interdependency and interrelation so that we unify the subject matter which is taught independently and in isolations. And this integrated curriculum therefore will help the graduates to put together the learned facts and to get a whole picture of the medical program and have a holistic approach of treating the patients. We intend that the integrated teaching will also help in developing critical thinking. So, which method to, for clinical problem solving. The reports from several medical schools have demonstrated that the integrated teaching helps in acquiring better knowledge. Next slide, please. So, which method to choose? You have a number of methods, you have a number of models. Next slide, please. So, now, depending on the domain, depending on the group size, on the resources available, the time frame, the level of learning, and the coverage of the subjects, that we can select a proper teaching learning method for our group. So in short, go on clicking, ma'am. No single method is the best method. Choose and adapt one or more teaching learning method and try your own, and there's no end to innovation. So what we say, like dil mange more, so more the methods, more the learning. Integration is therefore planning jointly, and begin your plan uh, and teacher sessions. There should be a meaningful outcome. The recommendation techniques of integrations should be used, and the prerequisites is that the SNOs or the competency should be ready by the departments when they're planning for integration. Otherwise, the purpose will be lost. Next slide, please. The very basis is planning of SLOs meticulously. Then a linker case. If a linker case is developed by the different colleges, when whatever linker case they develop, it must be disciplined, it must be relevant for more than one discipline, so that a particular subject is covered as a whole, which will be always beneficial. Next slide, please. A good timetable, correlations like linkers should be visible. Nesting, these are the lesson plans. Sharing, these should also be reflected in the lesson plans itself, so that the teaching and learning will be better. Next slide, please. Some faculties may be unaware of integration. It may be difficult to communicate. Hold regular online sessions on new topics. Document them properly. Interpersonal problems should be sorted out by the faculty, keeping the HOD on the track. The idea about integration varies from person to person and even faculty. So be liberal and respect others' ideas also. There may be certain overzealous faculty. Ask them to be to do certain medical projects and come with their unique ideas and scale up the situations. Next slide, please. So plan jointly, which is a must. Don't lose sight of the learner, that we should finally have an Indian medical graduate who should be holistically taught. Use the recommended techniques. Nesting and sharing can be very easily done in this competency tables. The linker case can be taken with the organ, with a topic, with a disease, or a health conditions. Share the ideas and agree to disagree when planning for integration with the other faculties. So, with a joint effort, we can be successful. Next slide, please. So, we will have an Indian medical graduate who will be a good clinician, a team member, communicator, lifelong learner, professional, and will be competent across all the domains and all the subjects, and will be able to translate the specific objectives to global competencies, and will be a competent graduate for being a first contact physician to the community. With that, uh, I end the session, and thank you so much.
Thank you so much, Dr. Uma.
My
Now
pleasure,
we
ma'am.
for a great revision of the last lectures points, as well as adding on to and talking about so many new methods and showing us how to do it actually. The most important point is that about 20% of our this thing, 20% of the teaching should be integrated type of teaching as per the new guidelines. And most important was that I think take home message was about the module based teaching. I think topic based modules developing from multidisciplinary topics, that is urinary tract infection, diabetes, tuberculosis, hypertension, or problem based modules developed for multidisciplinary clinical problems like acute abdomen, shock, and headache. Then task-based modules like derived from multidisciplinary tasks like first aid, CPR. I think they were very good examples that you gave us. And now I move on to some comments and some suggestions and experience sharing. Dr. Amita, are you there, Dr. Amita? Neha, I'm unable to unmute Dr. Amita.
Ma'am, she is offline, ma'am.
What
She
does
was
that mean?
previously online, but now she's offline, ma'am.
Okay. So any comments, experience sharing, all those who are already doing some form of integrated teaching, can they share their experience?
Ma'am, excuse me. Ma'am, in the
Yeah.
chat box, Dr. Suchi Agarwal has said excellent presentation, very well explained. And ma'am, Dr. Archana Sinha has asked difference between nesting and sharing.
So Dr. Uma, please.
See, nesting is like when I'm teaching prolapse in my class and the supports of uterus is being taught by me itself is nesting. And if I call someone and they tell about supports, then it is sharing.
I hope that was clear, Dr. Archana.
Ma'am, I have also unmuted Dr. Archana if she wants to talk to Dr. Uma.
Yes.
Okay, thank you.
Thank you, ma'am. Thank you, ma'am. Now it's clear. I was confused between sharing and nesting, but now it's clear. If I am teaching the topic, then it's sharing. If I'm asking other faculty from anatomy to describe the supports of uterus, then it is, then it is nesting. Actually, I often gets confused with both these terms.
Dr. Suchi, you would like to add some comments?
Ma'am, we are having an integrated session in our specialty. Like we choose a topic, and every month we conduct a session topic based, like lump abdomen, acute abdomen, and we hold a joint session incorporating faculty specialties. It is 3 to 4 hour session for undergraduates, 8 to 9 semester student. And
So
people are students give very positive feedback, and it's very fruitful.
okay, thank you so much. Dr. Malti, you are unmuted. Dr. Malti, yeah.
Yes, madam. Good evening. I just wanted to know because madam said that generally sharing is done to remove the redundancy, but at times we don't mind repeating the SLOs where it needs lot of emphasis. Can I have just one example? I just wanted to know one example on that.
Dr. Uma?
See, the example is like suppose you want to tell about anemia. The student must know the classification of anemia, WHO classification, they should know. Suppose it has already been told once, while you are taking another session and beginning, just to revise the definition alone might not be anything bad. That is like just repeating that same LO to reinforce the learning.
Okay, thank you, Dr. Uma. I will just give you an example. Today, incidentally, we were discussing the learning objectives for the first 25 lectures for the timetable in OBGY. And there was a lot of discussion on whether we should be repeating the physiology of menstruation and the physiology of ovulation, because that is already talked about. It is one of the competencies for the first year student. So now we all agreed that it is so important because there's application in infertility, there's application in amenorrhea, puberty, everything. So we thought we will again repeat that as a part of the learning objective in the OBGY. So that is one example. Dr. Manisha, would you like to? Dr. Manisha Ladad, she says it was a very nice presentation. Any questions, Dr. Manisha, or experience sharing? I unmuted you, Dr. Manisha. You can unmute yourself and talk. Dr. Satinder, I unmuted you.
I also. Can
Dr.
you hear?
Satinder.
Hello.
Who's that?
Audible?
Yeah. May I know the name and know your name, please?
Hello.
Yeah.
Manisha Laddad.
Yeah. Okay.
Ma'am, I want to give one suggestion. What we do in our department, we used to show the video conference through the telecon, means through the videos to some demonstration or operative surgery, whatever we are conducting in the operation theater. And at the same time, we try to discuss that topic with the undergraduate students. So that is also one of the best method to demonstrate the live telecast to the students, and at the same time, we can elaborate the anatomy, pathophysiology related with obstetrics and gynecology.
Elaborate what? Sorry, your voice was cut off. Dr. Manisha, can you repeat? Dr. Satinder.
Hello. Good evening, ma'am.
Yeah. Good evening.
Good evening. Yeah, I fully agree with your concept, ma'am, that when we are, although the physiology and the anatomy, although they have been covered, but when we are, the students are coming to us, especially in the phase 3, new final and old final, then I mean, it's very good to reinforce these things, because now they are more clinically oriented to that thing, so they will be, I mean, the understanding will be better. So it will be very good to at least touch those subjects again for a short period to reinforce the thing, so that they can relate more with the clinical aspects.
Yeah, I think it's a brilliant idea to
Yes.
let the anatomist talk about the applied anatomy on a
Yes,
particular
yes,
area where,
yes,
yeah, I think it's brilliant. And making use of the technology also. It's a very good use.
yes.
Okay, thank you. So any more questions or experience sharing? Dr. Hema. Dr. Hema. Dr. Hema Dhumale, I unmuted you. Dr. Manjeet. Dr. Hema, Dr. Manjeet.
Yes, madam. Good evening, everyone. There is a different type of teaching learning activity like flipped classrooms. So whatever you are telling, that repetition of anatomy, physiology, whatever they've already learned in their first and second years, what we can do, we can share this content earlier before the class, so that all students will go through that content. And in our class, instead of repeating, we can just directly go to the applied aspects. So by this, we can save a lot of time, as well as, redundancy and repetitions.
Yeah, yeah, that
Yeah,
is
thank you so much, Dr. about that. Our basic aim is to cut the redundancy, to remove the curricular obesity, to avoid repetition. And I think flipped classroom is a very good idea, or giving home assignments
Yes,
to just build up the next class on the previous knowledge, and give them
true.
the learning objectives as home assignment or as a flipped classroom, and then go ahead and finish the whatever is more important to us, the clinical aspect later on. Thank you so much.
Very,
Dr.
very
Manjeet.
true. Thank you.
Dr. Manjit Mohi.
Hello. Oh, yes, yes. Good. Hello. Good evening, everybody. Am I audible? Hello,
Yeah, you are audible.
am I audible?
Yeah, you're
Okay.
audible.
Yes, yes. I just wanted to share that once we are teaching to ninth semester or eighth semester students, I think once like I always used to teach oncology. So what I personally feel until unless I revise them the anatomy of lymphatics, of uterus, of artery, of all means great vessels, I was not able to teach them properly what I am speaking. So I think it is very, very important to revise those things again and again, at least in some of the areas. Otherwise, we are not able to justify our teaching it. This is what I wanted to convey.
So yeah, I think we discussed that. That is
Yes,
what I think Dr. Satinder was talking about.
yes, yes.
So in order to do that, give that learning objective, because they are important ones, like you already say you wanted to emphasize on that, as
Yes,
either do it as a flipped classroom or do it as a home assignment. Thank you so
definitely,
much.
definitely. Thank you, ma'am.
So any more inputs? So can we call it a day? Can we stop now? Because I can't see any more questions or raised hands. Thank you very much. Dr. Uma?
Thank you so much, ma'am. Welcome.
Yeah, okay then. Thank you so much, everybody. Bye-bye.
Bye, ma'am. Thank you.